Hi, so today we'll be talking about water breaking, otherwise known as amniotic fluid rupture. So for the introduction, it simply means rupture of the membrane, amniotic fluid. So the amniotic fluid is usually enclosed in a sac known as the amniotic sac. And this process can actually happen during labor, it can happen before labor, and it can happen even before the 37 completed weeks of gestation. So we are here to talk about what to do in order to prevent infection for both the mother and the baby. How do you recognize that your amniotic fluid has ruptured? There's usually a sudden gush of clear fluid, warm, it's usually warm, and it could be trickling or leaking, and it doesn't like stop like urine. So if you notice this, you know that okay, yeah, I'm having amniotic fluid rupture. And then what do you do immediately you notice this? The first thing to actually do is to stay calm. Because when you're panicking, this increases your stress hormone and it doesn't help the labor. And then what do you do immediately you notice this? Now, the second thing to do after staying calm is to note these details that are written down here. The first thing to note is the time that the membrane ruptured, the color of the fluid. This color is very, very important. The color can be clear, which is usually the normal. It could be meconium stained, usually dark colored, brownish, something like that. It could be blood stained. Blood stained means get help immediately, emergency situation. When it's dark colored, meconium stained, you know that the baby has passed through inside the fluid and it's a sign of fetal distress. Help is needed immediately. These are the things you don't do during this time. Don't insert anything into your vagina during this time. Do not have sex and do not douche. Go to the hospital? Yes. Yes and yes, or at least get help. Water breaking before labor, like I said, it could happen during labor, it could happen before labor, it could even happen before the 37 weeks of gestation. So when it happens before labor, it's usually called PROM, which means pre-labor rupture of membrane. And usually occurs at 10. Before labor means, okay, yes, you've gotten to 37 completed weeks of gestation, but your contractions have not started. And your membrane has already ruptured. This can predispose you to infection, especially if the labor delays or it takes time. So that is why I said monitoring is important. So you need to get help. So if it happens before 37 completed weeks of gestation, it's usually known as PPROM, which is preterm pre-labor rupture of membrane. And it's an emergency situation. You need to get to the hospital immediately because most of the time the management is hospital admissions, street bed rest, and other things involved with close monitoring. These are the common things that people believe about amniotic fluid rupture. One of them is that if the water breaks, the baby will fall out. Please, is this false? If the water breaks, the baby will not fall out. The baby is protected and supported by your perineal muscles, your pelvic bone environment. The whole environment there will not allow the baby to fall off just because the membrane ruptured. The baby is still supported. And then you must deliver immediately. It doesn't usually happen like that. It depends on a lot of factors, which is why we said get help immediately. Go to the hospital. They will assess you and know about the next line of action or inform you about the next line of action. If it's just a leak, it's nothing. No, all those leaks matters because the leaks will actually accumulate to massive drainage if care is not taken. And once your liquor is drained to some extent, the environment is not usually conducive for the baby anymore, and this can lead to fetal distress and also predispose you and the baby to more infections. Always wear a pad and not a tissue. The reason is that tissues can disintegrate once they come in contact with a fluid or water substance, and it can enter into your body. Particles of it can enter into your body, thereby increasing your risk for infection. So once you notice that you started draining, please put on a pad immediately and then start getting help. Monitor your baby's movements, like we've mentioned earlier. Do not self-medicate, and then keep your hospital contacts ready. If you notice that your water has broken or is breaking, stay calm, note the details, and contact your healthcare provider immediately. Early actions usually protect you and your baby from infection and your baby too from fetal distress and every other condition that could arise as a result of it. Thank you so much for listening. See you next time.